Hi everyone, welcome back to my YouTube channel. Today I will be going over OSHA fact sheet on protecting yourself when handling contaminated sharps. Let's get started. Sharps are objects that can penetrate a worker's skin, such as needles, scalpels, broken glass, capillary tubes, and the exposed ends of dental wires. If blood or other potentially infectious materials, or OPIM, as defined in the OSHA Bloodborne Pathogen Standard, which is your Title 29 Code of Federal Regulation Standard number 1910.1030, are present or may be present on the sharp, it is a contaminated sharp and appropriate personal protective equipment must be worn. A needle stick or a cut from a contaminated sharp can result in a worker being infected with human immunodeficiency virus or HIV, hepatitis B virus or HBV, hepatitis C virus or HCV, and other bloodborne pathogens. The standard specifies measures to reduce these types of injuries and the risk of infection. Careful handling of contaminated sharps can prevent injury and reduce the risk of infection. Employers must ensure that workers follow these work practices to decrease the workers' chances of contracting bloodborne diseases. Safer medical devices. Employers are required to consider and use safer medical devices wherever possible. These devices include those that are needleless or have built-in protection to guard workers against contact with a contaminated sharp. In addition, employers must ask non-managerial patient care workers who could be exposed to contaminated sharps injuries for their input in identifying, evaluating, and selecting effective work practice and engineering controls, including safer medical devices. The employer must document consideration and implementation of these devices and the solicitation of worker input in the exposure control plan. Prompt disposal. Employers must also ensure that contaminated sharps are disposed of in sharps disposal containers immediately or as soon as feasible after use. Sharps disposal containers must be readily accessible and located as close as feasible to the area where sharps will be used. In some cases, they may be placed on carts to prevent patients such as psychiatric patients or children from accessing the sharps. Containers also must be available whenever sharps may be found, such as in laundries. Contaminated sharps must never be sheared or broken. Recapping, bending, or removing needles is permissible only if there is no feasible alternative or if such actions are required for a specific medical or dental procedure. If recapping, bending, or removal is necessary, employers must ensure that workers use either a mechanical device or a one-handed technique. The cap must not be held in one hand while guiding the sharp into it or placing it over the sharp. A one-handed scoop technique uses the needle itself to pick up the cap, and then the cap is pushed against a hard surface to ensure a tight fit onto the device. Also, the cap may be held with tongs or forceps and placed over the needle. Contaminated broken glass must not be picked up by hand, but must be cleaned up using mechanical means such as a brush and dustpan, tongs, or forceps. Sharp containers. Containers for contaminated sharps must be puncture resistant. The sides and the bottom must be leak proof. They must be appropriately labeled or color coded red to warn everyone that the contents are hazardous. Containers for disposable sharps must be closable, that is, have a lid, flap, door, or other means of closing the container, and they must be kept upright to keep the sharps and any liquids from spilling out of the container. The containers must be replaced routinely and not be overfilled, which can increase the risk of needle sticks or cuts. Sharps disposal containers that are reusable must not be opened emptied, or cleaned manually or in any other manner that would expose workers to the risk of sharps injury. Employers also must ensure that reusable sharps that are contaminated are not stored or processed in a manner that requires workers to reach by hand into the containers where these sharps have been placed. Handling containers. Before sharps disposal containers are removed or replaced, they must be closed to prevent spilling the contents. If there is a chance of leakage from the disposal container, the employer must ensure that it is placed in a secondary container that is closable, appropriately labeled or color-coded red, and constructed to contain all contents and prevent leakage during handling, storage, transport, or shipping. Workers' rights. Workers have the right to working conditions that do not pose a risk of serious harm. Workers have the right to receive information and training in a language and vocabulary that the worker understands about workplace hazards, methods to prevent them, and the OSHA standards that apply to their workplace. Workers also have the right to review records of work-related injuries and illnesses. Workers have the right to file a complaint asking OSHA to inspect their workplace if they believe there is a serious hazard or that their employer is not following OSHA's rules. OSHA will keep all identities confidential. Workers have the right to exercise their rights under the law without retaliation, including reporting an injury or raising health and safety concerns with their employer or OSHA. If a worker has been retaliated against for using their rights, they must file a complaint with OSHA as soon as possible, but no later than 30 days. I conclude my presentation here with a reference slide. Hope you found this information helpful. If you enjoyed this video, please consider subscribing to my channel and leave me a few comments. I will see you in the next video. Bye now.